the secondary healthcare centers and the tertiary healthcare centers, it is important that data exists on what the government should be addressing. In this regard, I must appreciate the fact that the Prime Minister, having been working for health since his work in the Shaukat Khana Memorial Hospital, setting up that hospital, he has been very concerned all his life, including all his charity works and motivation of the people, that health should be available for everybody. And if that is kept in mind, the primary importance of health starting from every home is dependent on the health of the mother and the health of the children. And the Prime Minister, I must appreciate that in his first speech, giving a direction to Pakistan and to the people of Pakistan while he was talking about international relations and peace, etc., etc., he put up an X-ray of stunting, as X-ray of the face and of the brain of stunting, and insisted that this issue has to be addressed because the figures of stunting in Pakistan are pretty high at 40%. Yesterday we talked about the demographic situation and population increase and what is expected. So it is of primary concern that as the population size is increasing, we should be looking at improving maternal health and reducing mortality, as well as at the same time to ensure good nutrition not only for the mothers but the children. So all programs which are working in that direction are important. What Pakistan, like all other countries, developing countries, may have gone through is the fact that infant formula milk was marketed in such a manner that mothers stopped feeding their children early, and the result was that the children in the first 1,000 days, when stunting is an important factor, they were probably underfed, and the mothers would wean them off breast milk very quickly. I take importance because the Prime Minister requested me to take charge of the task force on population, and I feel it is very important that there should be a breather, there should be a gap between pregnancies, which shall improve both the fact that it gives time for the recovery of the mother from one pregnancy to the second pregnancy, as well as the fact that it improves the chances of the children not going through malnutrition. So along with iron supplements for the mother and nutritionary supplements for the children, I think that gap in pregnancy is a very important fact. Therefore, as a part not only of maternal health, as a part of trying to suggest a pregnancy gap to the families, this government has been encouraging, and from the task force of population, I have been encouraging the fact that whatever works in a society, if the society believes in the Quran, for example, in Islam, the directions of Allah subhanahu wa ta'ala in the Quran, where on 3 occasions he mentions that the mother should feed their children breast milk for 24 months. On one occasion it is said that 36 months. Taking advantage of that, we should be able to convince our population that this is one way of reducing frequent pregnancies and trying to improve maternal health. What happens as a corollary or as a coincidence attached to the fact that the mother is breastfeeding, that the chances of getting pregnant are less during the time that she is breastfeeding. So one of the ways where we are trying to encourage population planning is the fact that we must increase the breastfeeding. And probably all new manufacturers of breast milk, in fact recently about a year ago another new company came into Pakistan, and I requested them that you must market in a manner where only where it is necessary infant formulas may be encouraged, but otherwise the message should not be as an alternate to breastfeeding that infant formulas should be there. It is important that the maternal mortality issue and maternal health is considered because that it increases stress in society. It increases the subsequent, as the children grow, it increases the health burden of society. And I'm pleased to know, of course, but still it is a matter of concern, that 186 has come down to 186 per 100,000 live births, the mortality ratio, the maternal mortality ratio, down from 276 recording in the Pakistan Demographic and Health Survey in 2006 and 7. I think we must achieve the sustainable development goal of 70 by the year 2030. We believe very strongly that if poverty in Pakistan has to be reduced, it is important that the health situation of the populace has to be improved also at the same time. What has happened also, that Pakistan has a huge coverage with lady health workers in close to maybe 100,000, maybe 40 or 50,000 in Punjab and overall in Pakistan. These lady health workers are the primary source of information going down into the grassroots. Of course, they carry a huge burden today because we believe that hygiene is important in society, because we believe that bad habits should be discouraged, because we believe that hand washing is important to prevent communicable diseases, because we believe there is a lot of messages which have to go into the household to the mother. Therefore, this program of Pakistan of the lady health workers is very important. But the survey also reveals that the rural areas have 26% higher mortality. I think this is important as far as communication is concerned, because as we communicate good habits, as we communicate prevention, because I am a very strong believer in my practice as a dentist all my life, I believe that 90% of oral and dental diseases are preventable. Similarly, I believe that the major disease burden of Pakistan is preventable. So therefore, the entire focus is on prevention. The entire focus is to ensure the fact that the children get a healthy life. Therefore, nutrition at that level is important. The good habits in the home are important for a healthy life. In fact, the COVID has brought in hand washing and in Pakistan, because we practice ablution 5 times a day. It was easy to accept that fact, and therefore there's a benefit from COVID. Although COVID is a bad disease, there are no benefits except the fact in 2 areas. One is hand washing and cleanliness. The other is the fact that the communication between the government and the direction regarding prevention has gone deep down in Pakistan society. Of course, in other societies in the world also, but I am talking about Pakistan has gone deep down. In fact, from the masajid, mosque. There's sound there? Hear me clearly? Okay. Okay. So, in fact, we believe that whatever measures are being taken are important as far as the goals which Pakistan have to address for its own good. And the more we go out in prevention, the more we go out in contraception, the more we go out in reducing frequent pregnancies, the more we go out in population control, the more we go out understanding from COVID the fact that there can be a telehealth system or a communication through all instruments of internet. That is an area which is increasing throughout the world. And in fact, I read 2 articles which I sent to the health advisor in the recent Economist, talking about the importance of staying at home, getting advice. In Pakistan, it's very important. It means the person coming back home after a hard day's work, a worker or a mazdoor may not eagerly take his wife or his children to a doctor because of affordability, because of the fact that he's come back home and it will be a big hassle. Maybe if we improved our IT communication to improve general health, In fact, in that child neonatal and maternal mortality are also important factors. So the advantage, one of the few benefits of COVID would be the fact that all these machines, all the IT systems we have geared up. In fact, had COVID not been there, it would have taken us 10 years to arrive where we were, where we are today. That has happened in education, and that I believe is very important as far as health is concerned. So it is important that these surveys point out what needs to be done, and I'm thankful to the Pakistan Bureau of Statistics, the National Committee for Maternal and Neonatal Health, supported by international partners including United Nations, the Population Fund, UK Aid, US Aid, ICF, International, and Bill and Melinda Gates Foundation. And let me close my talk with the fact that Pakistan, in the good leadership of our Minister of Planning, Mr. Asad Umar, and of the committee which was looking at COVID, has performed very well. In fact, that they have established the systems and the hierarchy downwards for communication of information, for response to health issues in a very nice manner. So I think those systems which have been generated in COVID will go a long way in making us achieve the sustainable development goals as far as health parameters are concerned. Thank you very much, ladies and gentlemen.